Hello everyone, welcome to the Analytic Moment. I'm Quentin Fisher, CEO of Healthcare Analytics, and this is a series on artificial intelligence for healthcare service providers. Last session, we laid out some high-value use cases for AI, where we drilled into a specific use case predicting appointment no-shows. We then talked about how to get to true value for your organization and embed this AI solution. Today, we want to talk about the health services market in general and why now is the time to get going with AI for your organization. The current diagnosis of the healthcare market really, some would say, is quite dire. Right now, the cost of healthcare in the US is double that for other first world countries. That increased cost we're paying has no material impact on outcomes. In order to battle these escalating costs, we really need to get a handle on our operational productivity in health services. On the clinical side, there's plenty to improve on with block and tackling as well. There's a Forbes article late in 2018 that stated that medical errors account for more American deaths per year than AIDS or motor vehicle incidents. So there's a lot of opportunity for improvement there. Also, we're seeing the disease landscape shift as well. In January of 2019, a study was published that Americans are more likely to die from an opioid overdose than in a car crash. So it's important that our medical system is nimble and adaptive enough to address these kind of changing threats to our health. So that's the need. We know the need's there, right? We also know that there's some new competitors in town. We have experience with how bad the IT footprint is in healthcare. It's quite segmented. It's very specialized. There are a lot of data silos, and in these silos, there's not a lot of collaboration or even clean data. So with the opportunity that we just mentioned and this relatively light IT footprint, companies with robust distribution, back office, and IT capabilities are really looking to enter the market and disrupt it. And AI is the center of the strategy for these companies. They're taking lessons learned from other industries and applying them to healthcare. These companies are also making strategic investments and making acquisitions as well to get into the game. An example would be Amazon and Berkshire Hathaway. They acquired PillPack in 2018, I believe, and they've also just put out a new solution, Amazon, called Comprehend Medical. And this is a solution that enables scanning of unstructured notes and other data to drive machine learning. And Walmart is also looking to get into the game and try and bring their everyday low prices to healthcare. And we all know that they have the infrastructure to do that as well. So with all this going on, we're also seeing a lot of progress with health services providers. They see a significant role for predictive analytics in their future. And in a study in 2017 by the Society of Actuaries, they found that 90% of providers are currently using or plan to use predictive analytics in the next 5 years. More than half of the healthcare executives in the organizations that are using predictive analytics expect to save 15% or more of their total budget in the next 5 years using predictive analytics. And in fact, a quarter of those executives are forecasting to save 25% or more of their total budget. So there's huge opportunities for cost savings. So let's recap. We talked about the current situation and the need in the healthcare industry, in the market, right? We also talked about some of the new entrants, the new threats into the health services market. And then now we're seeing a number of health service providers jump on the bandwagon and really adopt predictive analytics. This trend is only going to continue as cloud-based solutions will drive further adoption and will actually reduce the barrier of entry for a lot of companies. Next session, we want to talk about some of the technology shifts that really allow us to efficiently move from this rear view mirror reporting that we're all used to prescriptive and embedded AI solutions. Thanks for listening. Please subscribe to the channel, Let us know your point of view and any questions you have in the comment section. And also get on our mailing list. Go on to hcanalytics.net and subscribe there. Thanks. Till next week, take care.